What's up, dedicated healers? That's your name now. You listening to this podcast, that means you're dedicated to healing yourself or even healing yourself and others. So, my dedicated healers, what's good, what's poppin'? So in my last episode, I talked about how I was in a hospital with a kidney infection. And that was in the Kewchie Chronicles part 2. And so within that, I wanted to provide a bit more information about, I guess, one, how I got kidney infection. And then 2, other types of STDs. Not really. I don't want to talk about STDs right now. I just want to really talk about how sensitive the coochie can be, and the different type of infections and discomforts us coochie havers experience. So if you're a coochie haver, open your ears. And so to start off, always pee after sex. Always pee after sex, right? So we break this down, and I'm gonna try to use medical terms as what they are medically termed as possible. But let's just start with, I think it's called the urethra. It's like this outside part. It's like basically the hole you pee out of. Any type of friction, and I'm not even gonna say pee after sex, girl, or coochie have pee after any type of play with yourself, with your fingers, anything, because my coochie sensitive, so any type of bacteria that was on your hand is now inside of you. Anything that was on the toy, always clean your toys before play, and after. And even if you know you cleaned it after you're about to use it, go clean that bitch again. Okay, go clean it again. And so what happens is that bacteria gets a part of your urethra. And your urethra is connected to your bladder, and your bladder is connected to your ureters. It's been a minute since I had this section in anatomy, but it's connected to your ureters, which is then connected to your kidneys. And so what happened to me is that I've been having some trouble with my bladder for a while, which I should have went to the doctor. I could have prevented a lot of the pain that I just was in. But nonetheless, I had some playtime. Shout out to me. And I was having a really hard time trying to pee afterwards. So I just thought, well, shit, maybe my guts is rearranged and they need a chance to settle down. They need a chance to settle down before I can release. So I'm trying to drink a bunch of water, trying to get myself to pee, but I couldn't. And so at that point, and in hindsight, I'm realizing that the bacteria, the infection the infection had already set in and was already crawling through that system that I just mentioned, the urethra, the bladder, the ureter to your kidneys. And so I felt like I had the UTI, and I use these suppositories, V vitamins, they're my go-to. And so I put one of those in there. Kewchie was feeling better. So I'm like, okay, great. Did that, feeling good, passed that, ready for, next round, next day, cool. But come to find out, the bacteria had already spread to my bladder, my ureters, and in my kidneys. And so by the time day 3, day 4 came around, I was in an excruciating amount of pain in my back because my kidney was infected. Some of this could have been avoided with some either extra cleaning, really trying to focus to pee, or even me going to the goddamn doctors whenever I was having a problem with my bladder X amount of time ago. But nonetheless, after going to the hospital, of course, they always mention you have to pee after sex. Like, babes, I know. I've been fucking for a while, and this is my first UTI, so I'm very well aware of how and what I need to be doing. Long story short, I'm on antibiotics, bed rest, and pain management. But I'm doing good, feeling better. At least now I can talk. Before, y'all, I couldn't even fucking speak. It was the worst pain I ever had in my life. So UTI stands for urinary tract infections. So your urinary tract is the system that I've been explaining. Your urethra, your bladder, your urine, and your kidney. And when y'all go on my website, I'm going to have the breakdown of this cycle, of this system, so you can kind of see it a bit more. And that is at insideperspective.org. I don't know if I'm going to have it like under podcast information, or like if you go to my website, you see that I have like all my podcasts on one page, and I don't know if I'll just add like another thing under it, like, you know, information from this episode, or I'll have an entirely different page that just says like Kewchie resources. I don't know. Be having fun with this shit, but nonetheless, now I want to tap into BV and oh no, I lost my other word. It's like trichomoniasis. I'm butchering the hell out of that. But a lot of these bacterial diseases come from, I don't like to call people dirty or things dirty. I'm trying to come up with another name. But nonetheless, unclean. Unclean things that happen. And then, especially for my people who have sex with people who have penises, they harbor a lot of bacteria if they do not have the most proper hygiene. So if you're curious as to why you keep getting BV or trichomoniasis, that, or even a UTI, more often than not, it's because of your partner, and then also because of your aftercare. So we always talk about aftercare after sex, how we want our partner to like cuddle us, kiss on us, get us some water, pat our forehead, drive the sweat, whatever it may be. But then there's the aftercare that you have to give to your body specifically. And your partner can do this too, but I'm a very let me do it type of bitch, until my lady comes around and I turn into a baby. But my doctor also said that sometimes, like, not only peeing after sex is good, but you may need to just give her a little wipe down, a little wash up, a little baby wipe. Just wipe all of that clear, because as great as sex feels, there is a transfer of bacteria occurring. There's good bacteria and then there's bad bacteria. And so to make sure that everything is all good and fine in that area, just give her a good wipe after you're done. I know we want to lay down and be all laid up and somebody got to lay in the puddle and all that, but it's in your best interest to get up and go pee, or to at least have a baby wipe or a washcloth. Warm washcloths are my favorite. Y'all ever got done going to Pound Town and get a warm washcloth laid across your coochie? Oh my goodness, a hit. So those are my coochie tips. But right now, as I continue to grow, and if anything, it's definitely going to be on my website more than not, and on my YouTube, because I'm getting into that bag. But I also want to come and give some coochie tips on my podcast every now and again until I get up back and running with the visual aspects of my podcast. So until next time, my dedicated healers, wipe your coochie, have great sex, and take care of yourself. Oh, and before I go, can't believe I forgot. When it comes to washing your coochie, you do not need to go up inside of her. You don't need to go up inside of the hole. Okay? You really don't. Like, the inside of the coochie is its own self-service, self-cleaning thing. And then you can get along the sides of her, in between your lips, but not like in between in the hole, but in between on the side of your lips. Like, we got that set. So get on the side, because some grime and some crust can get there too, which could also lead to bacterial infections. I'm not a fan of using like any type of Summer's Eve. I can't even say the damn Summer's Eves, whatever the damn product is. I'm not a fan of those. And a lot of gynecologists say that those are not good for you. But your coochie is yours. Do what you feel as though is best for you. But watch even what type of soap that you use, because if you're using antibacterial soap down there, you have to be careful, because like I said, there's good bacteria and there's bad bacteria. And so if you're using antibacterial soap in general, you're stripping everything away, which could also cause problems as well. And how could I not mention yeast infections? My Lord. And the difference between a yeast infection and a bacterial infection is a yeast is a fungal infection. Y'all, if you've had a yeast infection, I've had a yeast infection before. Oh my goodness. And I went and got a monostat, bro. If you want to feel like you want to rip your vagina off, then go ahead and use that monostat. But if you want to just have a nice little time, go get you a boric acid suppository. Boric acid suppository. Follow the directions on a little bottle, okay? Don't try to shove 5 of them up there, even though I know it's itching and you over here like a little little creamsicle. Over there like a little creamsicle, and the shit's uncomfortable as hell. But do not. I mean, the monostat's gonna work. Like it will work, but oh my god, it makes you feel like you want to rip your vagina off, because it's killing the yeast. It's stripping the yeast from your vagina. And then also another thing, not all this coming to me now, more often than not, most people, like even this happened to me and my mother, and a couple of my friends too, if you take UTI medication, it ends up giving you a yeast infection. I don't know how. I may have to do some research and then find that on my website as well. But yeah, so to do that, drink or eat or take a pill form of probiotics. I'm not sure of the exact science, but it does help prevent a yeast infection, or it getting to a terrible yeast infection, which then needs more medical treatment. So those are a few more tips for y'all. And then also learn how to sleep with no drawers on. For a while, mostly in like when I was younger, like middle school, I always slept with a bra and underwear on. I never let my body breathe. And it's really important to let your body breathe and get some air, because if you're consistently wearing yoga pants, if you're consistently wearing thongs and yoga pants, you're not giving your body any chance to breathe. It don't matter how thin them leggings are, or it doesn't matter. Whenever you do want to give yourself some breathing room, at least from switching up your underwear so you're not constantly wearing thongs or lace, some cotton grandma panties will always save the day. Send yourself over to a Walmart, a Target, wherever, bro, and get yourself some cotton panties, specifically during your period too, because that helps. And then make sure that you're, changing your tampons as you should. No more than 3 hours. Switch that baby out. I'm a fan of the cup. I've been using a Diva cup, mostly because I feel like I'm saving money, because I'm not buying tampons or pads every single month. But then also because the cup only holds the blood. And so any other secretions that are coming out that like a pad or a tampon would pick up, causing it to fill up a little faster, I don't have to worry about. So I still wear a panty liner, because, she be on the gush on the period. I don't know what the fuck that is. Well, it's because it's cleansing. It's cleaning itself. That's discharge. Discharge, too. I actually might ask my friend, because she's super, super knowledgeable in this thing. So I may send her a little, like, come on my podcast. Talk to us for our next Kewchie tips. Because your discharge all means different things. Because there's, like, let me look it up real quick so I'm not out here spreading false knowledge. Come on, brain. Different discharges. There we go. Oh, there's a whole little picture. Oh yeah, I got you. I'm gonna put this up here too. Okay, so white is healthy discharge, but could also mean a yeast infection. Sad. Yellow greenish discharge is from a sexually transmitted infection. Red, your menstrual cycle. They also have some things about it being a cervical infection, cervical polyp, endometrial, or cervical cancer. Take this lightly. More often than not, if you don't have any other symptoms that relate to cancer or a polyp or infection, you're probably just on your period. It's coming out pink. Cervical bleeding, vaginal irritation, or implantation bleeding. So I'm assuming if you have a oh my god, now they're escaping me. Like, there's certain type of birth controls that are inserted. So like that could be playing a part. And if it's gray, that's BV. And then clear is also healthy discharge, pregnancy, ovulation, or hormonal imbalances. You know, honestly, y'all, just a little side note, I think it's so ghetto that the same symptoms that are for pregnancy are the same symptoms for your period. Like, why are you trying to play with me? Why? Why? So they even talk about like drying stickiness with cervical mucus, tracking your fertility. So if you're good at counting the days of your cycle, I'll throw this picture up there too. They're probably helpful. It's talking about days 1 through 6, dry and sticky, and then days 7 through 9, if it's creamy, you're not fertile. But if you're wet and clear and it's like an egg white between days 10 and 14, you're fertile. So I have heard about that, wet and clear, like being fertile. So that's helpful whenever you're out there, you know, having your time with the penis havers, and you're not trying to bring in another human. Pay attention to your discharge and what those things look like. So I got a lot of work to do because I got some information to put up on my website, but I want y'all to know I love this shit. I love teaching, I love educating, I love sharing, and I'm very open about who I am. I don't really care if you judge me, because if you judge me, it just means you don't like yourself, and that's something for you to unpack. I mean, it doesn't mean that it doesn't hurt me for at least a moment, but then I remember it's because you don't like yourself. So until next time, my dedicated healers, keep taking care of yourself.